Airlink is the medical transport system for helicopters based at Medical Center Rockies in Loveland, and we started operations in February of 2012. Airlink provides critical care rotor transport, and we go between hospitals, also known as interfacility transports. And we also do scene work, so we'll pick you up at a scene of an accident and fly you to the local trauma center or cardiac center or whatever type of facility you need.
You know, the environment that we operate in, we do realize that it's got its challenges with safety. Anytime you mix two high-speed careers, aviation and medicine, we're living on the edge, so to speak, and we do our best to mitigate that.
Safety is the most important part of the mission. Without keeping that in the forefront, what good have you done if you delivered all this care to the patient and then something went wrong and there was an accident? So we spend a lot of time and energy on keeping safe.
900, clear by 207 on EMS North.
207, go ahead.
Get a party that's been hit by a car at Rift Canyon. Okay, the patient is a 30-year-old female struck by a car. She's got head injuries. She is unconscious.
Okay, copy, and the chopper has been requested.
Once we receive a call to do a transport, we start heading to the helicopter. We prepare the helicopter for flight.
Airlink 2, we are off Medical Center Rockies, northwest bound for Rift Canyon LV.
Clear Airlink 207, Airlink has ETA of 5.
And then as we're flying there, we'll do drug calculations based on weight if we have that. But otherwise, most of the communication is done within the crew, within the confines of the helicopter. One of the things that we like to tell people is that we're part of the chain of survival. So it really depends upon the fire department, the emergency personnel on scene, such as the ambulance services, the paramedics. We then get the patient from the scene to the hospital, and then the hospital takes it from there.
So as we're assessing the patient, we're starting to come up with a game plan of, do we need to have a patient on a certain type of medication? What do we need to be doing to help this person?
It takes a lot of creative problem solving. Flight crews are intently keen, enthusiastic, quick at assessments, quick to make the right decision.
We bring the ICU background, so a lot of critical care, a lot of hemodynamics and drips and ventilator management.
We're prepared for anything that you can think of in that helicopter. Any drug you can imagine or any supply, it's in that helicopter somewhere. It's a pocket somewhere.
Airlink has departed.
As soon as we can get a good assessment on the patient, we'll notify the hospital we have an incoming trauma. We'll let them know what level of trauma we want, whether it's a full trauma or limited trauma. It's based on the patient's criteria, their measure of injury. The emergency department will send out usually one or two helpers, a couple of techs from the ER to help us offload the patient. We'll bring the patient in the emergency department and we'll give a report to the trauma team that awaits us and basically give care of the patient to the trauma team and let them take it from there.
If you want the patient to have the best outcome possible, get back to what they love to do, you all really have to be on the same page with a common goal of maximizing that patient's outcome.
We all care for the people that we treat. We want to help people, and it's a genuine desire to be there when somebody needs you the most. I know when I'm on the ground and our team flies over, I wish I was up there with them.